Welcome back to the Deep Dive. We're here again to dig into expert knowledge, pulling out the key insights you need to really upgrade your understanding.
And today, we're tackling something huge: anxiety, chronic stress. It affects so many of us. But we're going beyond the usual advice. We're looking at the biology.
Right, and here's the big shift in thinking, the core idea for today. What if persistent anxiety and that feeling of chronic stress aren't just psychological? What if they're fundamentally physiological problems, rooted in how your autonomic nervous system is, well, regulated, or maybe dysregulated?
Exactly. It's not just about your thoughts. It's about the actual measurable state of your body. For so long, the approach has been very top-down, trying to reason with anxiety, talk yourself out of it.
Trying to use logic when your body is screaming danger.
Precisely. But the neurobiology is clear. That deep survival system, the one controlling fear and safety, it operates mostly below conscious awareness. If your body's alarm bells are ringing, your logical brain often gets, well, overridden.
Okay, so let's really unpack this. The mission for this deep dive isn't just about coping strategies for symptoms. It's about exploring scientifically grounded, bottom-up techniques, ways to actually regulate, strengthen, and balance the nervous system itself.
We're aiming for what you might call physiological resilience, real biological robustness.
Building that inner strength from the body up.
That's the goal. And our sources today give us a fantastic blueprint. We're drawing on core concepts: the autonomic nervous system, the crucial vagus nerve, and Dr. Stephen Porges' really insightful polyvagal theory.
These sound complex, maybe a bit intimidating.
They can seem that way, but we're going to break them down into practical, everyday tools, things you can actually use.
That sounds incredibly valuable, exactly the kind of deep knowledge people are looking for right now. And if this kind of detailed, actionable insight is what you need, we really invite you, the learner, to join our community.
Yeah, definitely hit that subscribe button. Share this deep dive with someone you think could benefit from this perspective shift.
Help us keep digging into these essential topics. All right, let's dive into that neural superhighway. Where do we start?
We have to start with the foundation, the unseen operator running things behind the scenes, the autonomic nervous system, or ANS.
The unconscious regulator.
That's it. Think of the ANS as your body's internal security system and climate control, all rolled into one, fully automatic. It handles all those involuntary survival functions.
Like heart rate, breathing.
Exactly. Heart rate, respiration, blood flow, digestion. It's working 247, constantly scanning your internal and external environment, making adjustments to keep things stable. Homeostasis.
And the critical point from our sources is why this matters so much for anxiety.
Yeah.
The state the ANS puts your body in often comes before conscious thought and can totally override it.
Absolutely. If that internal security system is yelling, threat, threat,
Yeah.
you can't just tell yourself, oh, everything's fine, and expect your body to instantly agree. The physiological reality often dictates the mental one.
Which is why we need that bottom-up approach you mentioned. We have to talk to the body first.
That's the core idea. We need to send signals of safety directly to those core survival circuits. We use the body breath, sensation, movement to calm the alarm. Then the thinking brain, the prefrontal cortex, can come back online properly.
Okay. So let's look at the main branches of this system. There are two key players, right? The accelerator and the brake.
A great analogy. First, you have the accelerator, the sympathetic nervous system, or SNS.
This is the one most people know, the fight or flight.
Exactly. Its job is to mobilize you. It dumps adrenaline and cortisol into your system, ramps everything up, gets you ready for immediate, intense action. When this system gets stuck on, clinicians often call it sympathetic overdrive.
And what would someone feel if they're stuck in that overdrive state? What are the signs?
Oh, you feel it physically. Your heart might be racing or pounding. You might notice that breathing is shallow, quick up in the chest. Muscles feel tense, braced. You might feel restless, agitated, unable to sit still.
And that feeling of being constantly jumpy.
On alert. That's hypervigilance, yeah. Constantly scanning for danger, feeling on edge. Your mind races because your body is screaming, do something, even if there's no obvious threat to fight or flee from.
The sources mention something interesting that doctors can actually measure this. Skin conductance, ED.
Right, electrodermal activity, or EDA. It's a way to measure how much your skin is conducting electricity, which increases with sweat gland activity, a direct SNS response. High ED means high physiological arousal.
So chronic anxiety, that feeling of constant worry and restlessness, it's basically the mental experience of being physically stuck in that high alert, high ED SNS state.
That's a very accurate way to put it. The system can't downregulate effectively. It's stuck with the accelerator floored.
Okay, so if the SNS is the accelerator, what's the brake?
That's the parasympathetic nervous system, the PNS. This is your rest and digest system, or sometimes rest and repair.
So the opposite function.
Completely. It conserves energy. It slows the heart rate, lowers blood pressure, directs resources towards digestion, recovery, tissue repair, deep rest. This is the state where healing and recharging actually happen.
And you mentioned a key metric for how well this brake works, vagal tone. Can you explain that a bit more?
Vagal tone is essentially the measure of your PNS efficiency. Specifically, it reflects how much inhibitory control the PNS, acting primarily through the vagus nerve, has over your heart rate.
So high vagal tone means?
High vagal tone means your brake is strong and responsive. When a stressor hits and your heart rate spikes, someone with high vagal tone can bring that heart rate back down to a relaxed baseline quickly and smoothly once the stressor passes.
It's like having really good brake pads in your car analogy. You hit the brakes, the car slows down promptly.
Exactly. Whereas low vagal tone is like having worn out brakes. You hit the pedal, but the system takes a long time to slow down. You stay revved up, anxious, mobilized, long after the need has passed.
So chronic anxiety could actually be seen as a sign of low vagal tone, a failure of the PNS brake.
That's a really powerful reframing from the sources. It shifts the focus. Instead of just managing anxiety symptoms, the goal becomes biological. We need to strengthen the vagal brake. We need to increase vagal tone.
Okay, strengthening the vagal brake. That leads us directly to the main player here.
Yeah.
The vagus nerve itself. Our sources call it the internal communication highway. That sounds important.
Oh, it's incredibly important. The vagus nerve, its cranial nerve number 10, is the longest cranial nerve in your body. It starts way down in the brainstem and wanders, literally vagar means to wander in Latin, all the way down.
Where does it connect?
It connects to your throat, your larynx, your heart, your lungs, your spleen, liver, stomach, your entire gut, essentially. It's this massive superhighway linking the brain to most of your major organs.
And it's not just one-way traffic, right? The communication goes both ways.
Critically, yes, it's bidirectional. It sends afferent signals from your organs up to your brain. This is huge for things like intuition, those gut feelings. Your body is literally telling your brain what's going on internally.
And the other way, brain to organs.
Those are the efferent signals, regulatory commands from the brain down to the organs. This is how the brain influences heart rate, breathing rhythm, digestion, even inflammation.
Okay, you mentioned inflammation. That link seems really crucial for overall health, not just anxiety.
It's massive because when your sympathetic system, the SNS, is chronically activated, like in chronic stress or anxiety, your body is also constantly pumping out low levels of inflammatory chemicals.
Part of the alarm response.
Exactly. But over the long term, this chronic low-grade inflammation is a key driver behind so many modern diseases. We're talking heart disease, potentially some neurodegenerative conditions, autoimmune issues.
Wow. So strengthening the vagus nerve, which helps calm the SNS and activate the PNS, could actually help reduce that harmful inflammation.
That's the connection, and it makes strengthening vagal activity a powerful preventative health strategy. It's not just about feeling calmer, it's about protecting your long-term physical health from that systemic wear and tear.
What I find really empowering about this is the idea that we can actually do things to strengthen it. There's not just some fixed biological trait. The sources talk about the democratization of resilience.
I love that term. It means that simple, everyday activities can act as natural vagus nerve stimulators, increasing vagal tone. Things you can do right now.
Like what?
Things like slow, deep breathing, focusing your attention consciously, humming or singing, even genuine social connection, feeling safe with others. These naturally nudge the system towards that PNS state.
So it takes vagal toning out of the realm of complex medical procedures and puts it into our daily lives.
Absolutely. It becomes an accessible self-care practice. Okay, so to really understand how the nervous system chooses between states like fight or flight or rest and digest, we need to bring in Dr. Stephen Porges and his polyvagal theory.
PVT. I've heard of it, but it can seem complicated. What's the core insight?
The absolute core insight is that your physiological state dictates your capacity for emotional regulation and social connection. It's not just that feeling stressed makes it harder to cope. Being in a specific biological state of defense fundamentally limits your psychological options.
So the body's state comes first.
Yes, and PVT gives us a map of how the system chooses its state. It's hierarchical, like climbing up and down a ladder based on perceived threat. Porges calls it the polyvagal ladder.
Okay, let's climb the ladder. What's at the top? The best place to be.
That's the ventral vagal complex, or VVC. This is the newest, most evolved part of the parasympathetic system. It's the social engagement system. When you're here, you feel safe, calm, grounded, connected to others. Your thinking is flexible, you're open, curious. This is the optimal state for learning, healing, resting, and relating.
Sound ideal. But what happens if danger appears?
If the system detects a cue of danger, the VVC pathway switches off, and you drop down one rung on the ladder to the sympathetic nervous system, the SNS.
Back to fight or flight.
Exactly. Mobilization. Your body prepares for active defense. You feel anxiety, maybe panic. Your focus narrows tunnel vision. You become hypervigilant. Flexibility is gone. It's all about dealing with the immediate threat.
And if fight or flight isn't possible, or the threat feels totally overwhelming, life-threatening,
then the system drops to the bottom rung, its most primitive defense pathway, the dorsal vagal complex, or DVC. This is also part of the parasympathetic system, but it's the oldest branch.
and this leads to
Immobilization, shutdown, the freeze or collapse response. Think of an animal playing dead. You might feel numb, disconnected, profoundly fatigued, heavy, maybe dissociated. It's a state linked to depression-like symptoms, hopelessness. It's a survival strategy of last resort.
so VVC for safety and connection, SNS for mobilization against danger, DVC for shutdown when overwhelmed. Understanding which state you're in seems crucial for knowing how to get back to VVC, back to safety.
Absolutely critical, because the strategy to get out of SNS, mobilization, is different from the strategy to get out of DVC, shutdown. But what decides which state we flip into? Often, it's happening unconsciously.
Through something called neuroception.
Exactly. Neuroception is Porteus's term for the nervous system's constant non-conscious scanning process. It's always evaluating cues from inside your body, outside in the environment, and between people, assessing for safety or danger.
So it's like radar, always running below the level of conscious thought.
Precisely. It picks up on things like tone of voice, facial expressions, posture, even subtle environmental shifts. And based on that scan, it automatically triggers a shift up or down the polyvagal ladder.
Meaning your body could react to, say, a slightly critical tone in an email and shift you into a defense state before your thinking brain even fully processes the words.
That's exactly how it works. Neuroception often overrides rational thought. If your nervous system perceives danger based on these subtle cues, the alarm sounds, and your physiology shifts, regardless of whether the danger is objectively real in that moment.
Which brings us back again to why those bottom-up, body-based techniques are so vital. We're essentially sending signals back to that neuroceptive system telling it, it's okay, you're safe.
You're providing biological evidence of safety to calm the unconscious alarm.
So what happens when the system doesn't just briefly dip into SNS or DVC, but gets stuck there, stuck in defense mode for long periods? There's a real cost, isn't there?
There's a measurable biological cost. It's called allostatic load. Think of allostasis as the normal process of adapting to stressors like your heart rate going up when you exercise and coming back down. That's healthy adaptation.
Okay.
But allostatic load is the cumulative wear and tear that results from the system being persistently activated, never getting enough chance to recover fully. It's the biological debt that accumulates from chronic stress.
And this isn't just about feeling tired or stressed out mentally. Our sources say this load damages multiple major body systems. It's a whole body issue.
Absolutely. The impact is widespread. Let's look at the 4 key systems highlighted. First, the cardiovascular system.
What happens there?
Constant SNS activation means chronically elevated blood pressure, increased heart rate. Over time, this actually damages blood vessels and accelerates atherosclerosis. That's the buildup of plaque increasing risk for heart attack and stroke. The engine is just running too hot for too long.
Okay, second system.
The neuroendocrine system. This is about hormones. Chronic stress means a constant flood of stress hormones like cortisol and adrenaline. Over the long haul, this isn't just bad for mood, contributing to depression and anxiety.
It affects the brain itself.
Yes, it can actually shrink the hippocampus, a brain region crucial for learning and memory. And it disrupts the balance of other important hormones.
Third, the inflammatory system. We touched on this with the vagus nerve.
Right. Chronic sympathetic arousal directly fuels chronic, low-grade inflammation throughout the body. And we now know this isn't just a side effect, it's a core mechanism driving or worsening conditions from arthritis and autoimmune diseases to potentially even Alzheimer's. It connects sustained anxiety directly to physical disease.
And the fourth system.
The metabolic system. High allostatic load messes with how your body handles sugar and insulin. It impairs insulin sensitivity, disrupts glucose metabolism, contributing significantly to metabolic syndrome and the risk of developing type 2 diabetes.
So it's this cascade of negative effects across the whole body. And it sounds like a vicious cycle, too.
It really is, because the damage caused by high allostatic load actually makes the system less able to cope with future stress. It becomes more sensitive, more hyperreactive. So each new stressor adds even more load, accelerating the wear and tear. That's why actively regulating the nervous system isn't just about feeling better now, it's crucial for long-term health maintenance.
This idea of the system getting stuck also seems really relevant to understanding trauma. The sources talk about trauma not just as a bad memory, but as a somatic imprint. What does that mean?
It means the traumatic experience gets locked into the body's physiology. The nervous system essentially gets frozen in the defensive state, either high alert SNS or shutdown DVC, that was active during the overwhelming event. It doesn't return to baseline safety.
So the body keeps reacting as if the threat is still present.
Yes, even years later. Relatively minor, present day triggers a certain sound, a smell, even an internal sensation can activate the full-blown neurobiological defense response associated with the original trauma. The body is running an old survival program in the present.
Which explains why just trying to think your way out of a trauma response often doesn't work. The body's alarm is just too loud.
Exactly. The intervention needs to address that somatic physiological imprint. Okay, so given these different states, high alert versus shutdown, knowing which state you're typically stuck in becomes really important for choosing the right strategy, right?
That makes sense. You wouldn't use the same approach for someone wired and frantic as for someone numb and collapsed.
Precisely. We need some critical self-diagnosis. Are you predominantly in sympathetic overdrive, that wired state, feeling vigilant, anxious, maybe can't sleep, mind racing?
If that's the case, what's the goal?
The goal is inhibition. You need to actively engage the PNS brake. You need calming, settling techniques to slow the system down.
Okay, but what if you're in the other state? Dorsal vagal shut down, the zoned out state. Feeling exhausted, heavy, numb, maybe foggy or disconnected.
Here, the goal is different and the order matters. Trying to force calm onto a shutdown system often backfires. It can feel invalidating or even increase the sense of collapse. The first goal must be gentle activation and safe mobilization.
You have to come out of the freeze first.
Yes, you need to bring some energy back online safely, maybe through gentle movement, before the system is ready for inhibitory calming techniques. Trying to apply the brakes when the system is already completely stalled doesn't work. You need a little bit of gas first.
All right, let's move into the practical solutions, the pillars of regulation. And the first one is incredibly accessible, the breath pillar. Our sources call breath the remote control for the PNS.
It really is. The connection between your breathing and your nervous system state is direct, immediate, and powerful. How you breathe directly influences your heart rate variability, or HRV, which is a key indicator of vagal tone.
And the key is slowing down the breath.
Specifically, intentionally slowing the rhythm, and most importantly, making the exhalation longer than the inhalation. That extended exhale sends a very clear signal via the vagus nerve. It's safe to relax. Engage the PNS brake.
And how you breathe matters too, right? Not just the speed, but where the breath is coming from. Diaphragmatic breathing.
Absolutely crucial. We need to prioritize deep diaphragmatic or abdominal breathing, where your belly gently rises and falls over that shallow, rapid thoracic or chest breathing that typically accompanies stress.
The difference.
Shallow chest breathing actually reinforces the SNS state. It signals the need for quick oxygen for fight or flight. Deep diaphragmatic breathing, on the other hand, stimulates the lower branches of the vagus nerve more effectively, signaling safety and calm. So slow, low, and rhythmic is the goal.
Okay, let's get specific. The sources outline some precision protocols. First up, box breathing, the classic 4.4.4.4. Why is this one so good?
Box breathing is excellent for establishing stability, especially when you feel scattered or overwhelmed. The equal timing inhale, hold, exhale, hold creates a predictable rhythm that helps regulate the system. It also prevents hyperventilating, which can sometimes happen in panic.
And the counting helps too.
Yes, the counting acts as a simple cognitive anchor. It gives your racing mind something neutral to focus on, interrupting those looping, anxious thoughts and helping to reduce that immediate cortisol surge.
So how do you do it precisely?
Simple. You inhale smoothly through your nose for a count of 4. Then you gently hold the breath in for a count of 4. Then exhale smoothly through your mouth or nose for a count of 4. And finally, hold the breath out, lungs comfortably empty for a count of 4. Repeat the cycle.
In 4, hold 4, out 4, hold 4. Got it. A great tool for immediate stabilization. What's next?
Next is a powerhouse for rapid calming, often called the physiological sedative, the 4-7-8 relaxation technique, developed by Dr. Andrew Weil.
4-7-8. What makes this one so potent? It's that longer exhale, isn't it?
Exactly. The magic is in the ratio, specifically that long 8-second exhale. Exhaling for roughly twice as long as you inhale sends an incredibly strong signal of safety to the vagus nerve. It powerfully activates the PNS brake, helping to downshift the nervous system very quickly.
How do you practice this one?
Okay. Sit comfortably. Place the tip of your tongue just behind your upper front teeth. Exhale completely through your mouth, making a gentle whoosh sound. Then close your mouth and inhale quietly through your nose for a count of 4. Hold your breath for a count of 7. Then exhale completely through your mouth with that whoosh sound for a count of 8. That's 1 cycle. Repeat it 3 more times for a total of 4 breaths.
Inhale 4, nose, hold 7, exhale 8, mouth, whoosh. And the sources mentioned impressive results.
They do. A regular practice, like twice a day, has been shown in some studies to significantly reduce anxiety symptoms. Some report over 50% reduction after maybe 8 weeks. It's particularly fantastic for tackling physical tension and is highly recommended for helping people fall asleep if they struggle with insomnia.
Wow, okay, so box breathing for stability, 4-7-8 for acute calming. What about building that long-term resilience, that higher vagal tone baseline?
For that, the key technique is coherent breathing, sometimes called resonance breathing. This is less about immediate crisis intervention and more about foundational training for your nervous system.
What's the goal here?
The goal is to synchronize your breathing rhythm with your natural cardiovascular rhythms. The specific target frequency is usually around 5 to 6 breaths per minute. A common pattern is a smooth 5-second inhale, followed by a smooth 5-second exhale, or maybe 6 seconds in, 6 seconds out.
Why that specific rhythm? Around 6 breaths per minute.
Research shows that breathing at this resonant frequency, around 0.1 hertz, tends to maximize heart rate variability, HRV. It creates a state of coherence where your heart rhythm, breathing, and blood pressure oscillations align optimally. It's like tuning your internal systems.
So this isn't for panic, but for daily practice.
Exactly. Think of it as your daily nervous system workout. Practicing coherent breathing consistently, even just for 5-10 minutes each day, helps to build vagal tone over time. It literally strengthens that vagal brake, making you more physiologically resilient to stressors when they do arise. It's the cornerstone of a proactive resilience plan.
Okay, so breath is a powerful tool. Now let's move to the second pillar, the somatic pillar. This focuses on the body itself, acknowledging that stress gets physically trapped.
That's the core principle. Anxiety, stress, trauma, they aren't just mental events, they create physical patterns of tension, bracing, or sometimes collapse held in our muscles, our fascia, our posture. Somatic practices work directly with these physical sensations to release that trapped defensive energy.
And this involves paying attention to the body, right?
Right.
Developing what the sources call interoceptive awareness.
Yes. Interoception is your ability to sense internal bodily signals. It's tuning into the subtle feelings, maybe a tightness in your chest, a knot in your stomach, a buzzing feeling, the temperature of your skin.
Why is developing that awareness so important?
Because it allows you to catch the early signs of nervous system dysregulation. If you can notice that subtle jaw clenching before it escalates into full-blown anxiety, you can intervene much earlier and more effectively with a breathing technique or a grounding exercise. You become more attuned to your own internal state.
Okay, so tuning in is key. What are some specific somatic techniques or hacks the sources mentioned for vagal toning? There were some surprising ones. Cold exposure.
Yes. Applying cold water, even just splashing your face or putting a cold pack on your neck and maybe upper chest triggers what's called the mammalian diving reflex.
The diving reflex.
Yeah, it's an innate physiological response that happens when mammals submerge in cold water. It instantly stimulates the vagus nerve and causes a rapid slowing of the heart rate and shifts blood flow. It's an incredibly fast way to put the brakes on an intense emotional spike like sudden anger, panic, or feeling overwhelmed. A quick, powerful PNS activator.
Interesting. And then there was humming, vocal toning.
It sounds almost too simple, but yes, remember, the vagus nerve runs right through your throat, connecting to the muscles of your larynx and pharynx. So activities that vibrate these areas like humming deeply, singing, chanting, even gargling vigorously, create mechanical stimulation of those vagal fibers.
Sending calming signals back up.
Exactly. It's a direct, self-generated way to gently tone the vagus nerve. And it's so easy to integrate. You can hum while you're driving, cooking, walking. A great little tool for transition moments.
And the third hack mentioned was touch, massage or self-touch.
Right. Gentle massage, especially around the neck, the shoulders, and even the outer ear, which has rich vagal nerve endings, can increase vagus nerve activity and help release physical tension. Even simple self-touch, like placing a hand over your heart or gently rubbing your arms, can send signals of safety and care to the nervous system.
These hacks are great because they're so quick and accessible you don't need special equipment.
Exactly. They democratize regulation. Okay, now let's talk about more structured somatic interventions. First, grounding techniques. These are vital for when you feel acutely anxious, maybe spinning out in your thoughts, or if you feel dissociated and disconnected, that DVC shutdown state.
What's the aim of grounding?
To pull your attention out of the internal storm, racing thoughts, numbness, and anchor it firmly in the present moment using your physical senses. When your attention is fully on tangible reality, it's harder for the mind to stay stuck in anxiety about the past or future or drift away in dissociation.
And how do you do it? Physical grounding.
Physical grounding is key. Consciously feeling the physical sensations of right now. Notice the pressure of your feet on the floor. Feel the weight of your body in the chair. Notice the texture of your clothes against your skin. Really bring your focus to those solid, real sensations.
And the sources often mention the 5-4-3-2-1 technique as well.
Yes, that's a classic and very effective cognitive sensory grounding tool. You deliberately shift your attention outward by naming. 5 things you can see right now, 4 things you can physically feel or touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste.
It forces your brain to engage with the external environment.
Exactly. It interrupts the internal loop of anxiety or the fog of shutdown by demanding engagement with present moment sensory input. It helps bring the VVC online.
Okay, grounding for anxiety or dissociation. But what about that deep DVC shutdown state? The fatigue, the numbness, the freeze. You said calming might not work initially. What do you do?
This is where somatic movement and release comes in, and it's crucial. If the system is immobilized, the priority is safe activation. We need to gently help the body discharge the trapped energy associated with the freeze or the incomplete fight-flight response.
Discharge trapped energy. How? Shaking.
Yes. Often techniques involve gentle, intentional shaking or trembling. Think about how animals often shake after a stressful event, like a chase. It's a natural way to release the neurochemicals and physical tension of that mobilization energy that got frozen.
So literally shaking your arms or legs.
It can be that simple. Gentle, intentional shaking of limbs, maybe tapping parts of the body, or even just allowing small, spontaneous movements or tremors to happen without suppressing them. The goal isn't vigorous exercise. It's about facilitating that physical release to complete the stress cycle neurologically.
Helping the system move out of the freeze and back towards a state where it can eventually find calm.
Precisely. You gently mobilize first, then you can introduce calming or grounding. It respects the polyvagal ladder. You have to climb back up from shutdown through mobilization before you can reach safety.
Okay, we've covered breath and somatics, the powerful bottom-up approaches. Now let's look at the third pillar, the mind pillar. This brings in the top-down strategies for cognitive and emotional resilience. And the cornerstone practice here seems to be mindfulness.
Yes, mindfulness is central because it bridges the bottom-up and top-down. Simply defined, it's about paying attention on purpose in the present moment and non-judgmentally. It's essentially attention training.
And it's not just a nice idea. The science backs it up strongly now, doesn't it?
Absolutely. Mindfulness-based interventions, MBIs, things like mindfulness-based stress reduction, MBSR, or mindfulness-based cognitive therapy, MBCT, are now considered gold standard approaches. Studies consistently show they can be as effective as cognitive behavioral therapy, CBT, for reducing symptoms of chronic anxiety and depression.
Why is it so effective? Is it just about being more aware of your thoughts?
It's more than just awareness. Mindfulness is an active practice that leverages neuroplasticity, the brain's ability to change itself. It literally rewires how your brain responds to stress and difficult emotions.
It actually changes the brain structure and function.
It does. Research using brain imaging shows that regular mindfulness practice can lead to measurable changes. For instance, it tends to reduce the reactivity of the amygdala.
The brain's fear center.
Exactly. It helps calm down that initial alarm system. Specifically, it seems to weaken the functional connection in pathways, like the one between the amygdala and the subgenual anterior cingulate cortex, SGACC, which is often overactive in rumination and depression.
So less reactivity from the fear center. Does it strengthen anything?
Yes, critically, it tends to enhance the activity and connectivity of the prefrontal cortex, PFC.
The brain's executive control center, responsible for planning, focus, self-regulation.
That's right. So you get less automatic reactivity from the alarm center, amygdala, and more effective regulation and perspective from the control center, PFC. It strengthens your capacity for conscious response rather than knee-jerk reaction.
And this connects back beautifully to the somatic work, right?
Yeah.
Mindfulness helps you notice those body sensations earlier.
Perfectly. Mindfulness cultivates that interoceptive awareness we talked about. It helps you tune into the subtle physical precursors of anxiety or shut down non-judgmentally. This allows you to integrate strategies. You can notice the physical sensation, bottom-up awareness, and then perhaps apply a cognitive reframe or choose a specific regulation technique, top-down response. It restores that mind-body connection.
Okay, mindfulness is key. What other mind-body techniques fit under this pillar? The sources mentioned progressive muscle relaxation, PMR.
PMR is a classic technique. It involves systematically tensing specific muscle groups for a few seconds, really noticing the feeling of tension, and then consciously releasing that tension, noticing the feeling of relaxation.
What's the mechanism there?
By deliberately contrasting the feeling of tension with the feeling of release, you train your nervous system to become more aware of subtle muscle tension it might be holding unconsciously. It also helps discharge physical stress and promotes overall relaxation, engaging the PNS.
Makes sense. And the last one mentioned was therapeutic visualization.
Yes, using guided imagery or visualization. This involves actively using your imagination to create detailed mental images of safe, calm, and peaceful places or experiences.
How does imagining a safe place help physiologically?
Because your nervous system, particularly through neuroception, doesn't always clearly distinguish between a vividly imagined reality and external reality. By intentionally conjuring and dwelling in a mental safe space, you are actively sending cues of safety to your nervous system. You're essentially using your mind to activate the ventral vagal complex, VVC, state of calm and security, directly countering feelings of threat.
Right. We have these powerful tools from the breath, somatic, and mind pillars, but knowing them isn't enough, right? The final part is about putting it all together consistently, building that resilience bank, as the sources call it.
Consistency is everything. Remember neuroplasticity, the brain changes through repetition. You can't expect to build strong vagal tone or rewire ingrained stress responses by only doing these techniques occasionally when you're already in crisis.
It's like exercise for the nervous system. You need regular workouts?
Exactly. The sources emphasize finding a minimum viable practice. Even if it's just 5 minutes a day, doing it consistently is far more effective than one long session once a week. That steady input strengthens those neural pathways for regulation over time.
Can you give some examples of how someone might integrate this into a daily routine?
Sure. Maybe you start the day with 5 minutes of coherent breathing to set a calm VVC baseline. Midday, if you feel stress rising, perhaps you use box breathing for a couple of minutes or do some gentle neck massage. Then in the evening, you might use the 4-7-8 breath or some PMR to wind down and prepare for restful sleep.
So having a plan for different times of day or different stress levels.
Yes, and that leads to the idea of a regulation escalation plan. This is about being proactive, knowing in advance which tool you'll use depending on the state you're in. You need to learn your own body signals.
So maybe tier 1 is your daily maintenance practice, like coherent breathing.
Right. Tier 2 might be for acute stress or rising panic. You feel your heart racing, thoughts speeding up. That's when you immediately deploy 4-7-8 breath, or maybe the cold water face splash.
And tier 3 would be for that shutdown state, feeling numb, heavy, disconnected.
Exactly. In that state, you know your first step isn't 4-7-8, it's gentle somatic movement like shaking or tapping to bring some safe energy back online first, maybe followed by box breathing once you feel a bit more present. Having this tiered plan removes the guesswork when you're already feeling overwhelmed.
Okay, that makes sense. Now, a really important troubleshooting point. Paradoxical anxiety. What happens when someone tries these calming techniques like deep breathing and they actually feel more anxious?
This is surprisingly common, especially for people with a history of trauma or chronic high anxiety. Their nervous system is so hypervigilant, so accustomed to being on guard, that the act of slowing down or turning attention inward can itself be perceived by the neuroceptive system as dangerous.
Stillness feels unsafe.
Exactly. It's like the system thinks, if I relax, I'll miss the threat. So trying to force calm can trigger more anxiety. It's a failure of neuroception misinterpreting internal cues.
So what's the solution? It sounds counterintuitive.
The solution is not to push harder with the calming technique. Instead, you need to shift gears entirely. You need to introduce safe movement.
Movement instead of stillness.
Yes. Gentle rocking, swaying, bouncing on the balls of your feet, shaking out your hands and arms, maybe even a brisk walk. This helps to safely discharge that restless, anxious energy, that trapped fight-flight impulse in a way that feels contained and voluntary.
And then try the calming technique again.
Yes. Once that restless energy has somewhere to go and the system feels a bit more settled through movement, then it might be receptive to something like box breathing or grounding. You have to meet the nervous system where it is. Don't try to impose stillness on a system screaming for mobilization.
That's a crucial insight. Finally, and this is so important, let's talk about safety and limitations. These self-regulation tools are powerful, but they aren't a replacement for professional help when needed.
Absolutely essential disclaimer. Self-regulation techniques are incredibly supportive for managing stress and building resilience, but they are not a substitute for clinical diagnosis and treatment, especially if symptoms are severe or significantly impairing your life.
How can someone differentiate between high stress that these tools can help with versus a potentially diagnosable anxiety disorder like GAD?
Generalized anxiety disorder, GAD, for example, involves excessive worry about various things, occurring more days than not for at least 6 months. And it's typically coupled with other symptoms like persistent fatigue, restlessness, difficulty concentrating, irritability, muscle tension, and sleep problems, causing significant distress or impairment in work, social life, or other important areas. If that sounds familiar, self-help might not be enough.
So what are the red flags where someone should definitely seek professional help from a therapist, counselor, or doctor?
If the worry feels uncontrollable, overwhelming. If you're having significant difficulty functioning in your daily life, struggling at work or school, avoiding social situations, if you're withdrawing from activities you used to enjoy, or if anxiety is co-occurring with other serious issues like depression, significant substance use, or disordered eating, these warrant professional assessment.
And the most critical safety point.
Always. If you or someone you know is experiencing thoughts of self-harm or suicide, that is a medical emergency. Please reach out immediately. In the US, you can call or text 988 anytime to connect with the Suicide and Crisis Lifeline. It's free, confidential, available 24/7. Please use it if needed. #tag conclusion, synthesis, and provocative thought.
Okay, let's bring this deep dive together. We've explored a fundamental shift in understanding anxiety, seeing it not just as a mental state, but as a persistent physiological pattern driven by autonomic nervous system dysregulation.
But the empowering part is that this pattern isn't fixed. It's trainable. We can measurably improve our regulation and resilience by actively working with our vagus nerve and increasing vagal tone.
And we do that through integrating the 3 pillars we discussed. The breath pillar, using techniques like 4-7-8 or coherent breathing to directly apply the PNS brake.
The somatic pillar, using body awareness, grounding, movement like shaking, and hacks like cold exposure to release trapped energy and signal safety physically.
And the mind pillar, leveraging neuroplasticity through practices like mindfulness to rewire the brain's fear response and strengthen executive control.
The bottom line for you, the listener, is that successful regulation really hinges on 2 things: consistent, deliberate practice, even small amounts daily, and learning to accurately assess your current physiological state.
Knowing, am I in sympathetic overdrive, feeling wired and needing to calm down? Or am I in dorsal vagal shutdown, feeling zoned out and needing safe activation first? That awareness dictates the right tool for the moment. You gain control over the internal mechanism.
So here's a final thought to mull over. What happens when we shift our focus from simply managing moods or avoiding stress to proactively building physiological capacity through nervous system regulation?
It changes the whole game of preventative health, doesn't it?
It really does. You're not just coping. You're actively strengthening your body's fundamental resilience against the cumulative wear and tear of stress, potentially buffering against a whole range of future diseases linked to allostatic load. It's investing in your long-term biological robustness.
A truly profound shift. You move from being reactive to stress to being proactively resilient. That's the deepest form of self-care. Thank you so much for joining us on this really essential deep dive today.
It's been a pleasure.
If you want to keep getting these kinds of expert-level insights to upgrade your understanding of your mind, body, and the world, make sure you hit that subscribe button so you don't miss our future deep dives. We'll see you next time.